Welcome to my podcast. Today I'm going to talk about another common case that happened. And you could see in the clinical setting, some of the women, they experience it. So I'm going to talk about menopause and the NICE guideline, the updated one. So to define menopause, it's basically permanent cessation of menstruation due to loss of ovarian function. And it's determined retrospectively after 12 consecutive months of amenorrhea. So the average age for menopause in the UK is around 51. However, it can widely vary from one place to another or from one man to another. And the earliest menopause could happen and occur between the age of 40-45. And it can happen sometimes before 40, whereby it's the premature ovarian insufficiency, and that's another different thing. Perimenopausal, it's basically when a lady hormones started to decline, and there will be like deficiency with certain experiencing symptoms of vasomotor, which include like memory problem, difficult concentration, fatigability, headache, and headache here can be differentiated from migraine, loss of stamina or decline in the stamina, night sweating, sleep disturbances, vaginal dryness, urinary symptom, irritability, and it could be that varied from one woman to a woman, and those symptoms seems to finish or decline as the menses ceased for around 12 months. And when we say about those symptoms, and the other side, some women, they don't experience any of those symptoms at all, and even if there is hormone decline. And has been stated that women approaching her 55, she doesn't need to take any contraceptive because the likelihood of conceiving is very low. However, magic or a miracle can happen in certain situation, like we know, like Janet Jackson and some other women who had obviously conceived. This is very rare. On the other side, certain women will experience physical and psychological symptoms that can be detrimental and could impact their quality of life dramatically and a great deal. So, talking from that, in order to manage symptom, which can be, as I said, from minimum to too much, can start with healthy lifestyle, and I mean by that, like decrease caffeine drinking, alcohol, try to be active and do some exercise or walking or jogging. And also, if the woman has extra weight or she's a smoker, she try to control that. And of course, this can be with or without hormonal replacement therapy, which can be tailored individually to each woman to suit her own needs according to the NICE guideline 2024. However, the hormonal replacement therapy prescribing trend varied across the past 20 years, and it has shown an improvement in the symptom and the metabolic effect as with association with the hormone deficiency. So in the short term, it could improve the mood and vasomotor symptom, sexual functionality, genitourinary symptom, and musculoskeletal benefit. However, in the long-term benefit, it will reduce the risk of osteoporosis and reduce the cardiovascular diseases if it was taking like 10 years of menopause. And it also seems that decrease the risk of colon cancer as well. However, in the long-term risk, that's not deniable. And there is a risk of thromboembolic disease and stroke if taken with oral contraceptive like estrogen and synthetic progesterone. However, there is no risk on the other side with transdermal estrogen and micronized progesterone. So it's important to assess and discuss those in terms of the benefit and harms with any woman to empower them to order to come up with their own decision for the treatment and the care right for them. Also, there is the idea of menopause support groups, like for instance, if the woman is working, have those vasomotor symptoms, so the employer should be aware of those kind of symptoms and should offer a flexible working schedule for those kind of things. And also the woman who has issue with concentration or memory, she can adopt the use to-do list on her own note or her mobile in order to help her memory as a prompt to what to do. It has been stated that there is complementary, like here in the UK, you can find them in any stores, like for instance, Home Bargain, I've seen them, St. John Wort, and there's something else called Black Kosh and isoflavine, which is not licensed for treatment. And there is also the soya milk and the red clover, which include or have isoflavine, and phytoestrogen, which is basically a plant alternative to estrogen, because it has the estrogen property and appear to show some benefit in the randomized controlled trial and meta-analysis. However, it has shown that the efficacy for vasomotor symptom is lower than the traditional hormonal replacement therapy. And also stating about the herbal treatment is not recommended for those with history of breast cancer. Additionally, the risk of the interaction if the woman is taking any other medication like tamoxifen or any other things. So we need to rule out and inquire and assess thoroughly. And also there is no evidence whatsoever for those herbs because we don't know their original. We don't know their origin, and we don't know their base, and we don't know about their quality, and also the purity, constitution, and safety unknown. I remember once, a long time ago, back home, there were like a Chinese center, and the practitioner there, they used to prescribe certain herbs for patients who had epilepsy, and it transpired that those pills which being given, they had the actual medication, but just given as under the name of herbs. However, we have to be vigilant in those kind of things, and we need to make sure and assess that the patient is not resorting to those things, and they are fully aware which might contain or not. And also we need to suggest about CBT and relaxation technique, and about the sleep hygiene, and learning to adopt a positive, healthy life attitude to the challenge of menopause. That's according to the NICE Guideline 2024. And it has been suggested that hypnosis can help with the sleep difficulty as well. And others, they recommended as well the acupuncture, which could help to relieve the hot flushes. And there's a statement also about yoga, as it has mixed evidence and may help overall for the well-being and feeling good. So any woman with perimenopausal or menopausal symptom should be offered hormone replacement therapy as the first option to reduce the risk of future diseases like, as stated, the cardiovascular disease, osteoporosis, dementia, colon cancer, and diabetes mellitus type 2. And if the woman, for instance, choose to opt out of those hormone replacement therapy and choose not to take them at all, you could offer, of course, the serotonin, a selective serotonin reuptake inhibitor, or serotonin and noradrenaline reuptake inhibitor to improve the vasomotor symptom and the mood swing. However, we need to think about what's those risk factors for osteoporosis. So any menopausal woman before the 45, she's at risk. Also, who is taking systemic steroid for more than 6 months or 6 months. Also, any patient or any lady with a history of anorexia with significant weight loss. And if there is a family history, positive one for osteoporosis, and I mean by that, the lady mom or her sisters. And also if the patient has history of fracture, and if the patient has history of low calcium or vitamin D intake, or has malabsorption, like those patients who goes for a certain operation whereby the bowel has been changed from its anatomy. And also, we need to tell the patient about the actual side effect of the hormonal replacement therapy, because it's not free of risks at all. So we need to tell them that they will experience certain symptoms for about 3 to 6 months, and it should decline with time. So those symptoms, it will be like fluid retention, which will increase the weight. Also, breast tenderness, feeling bloated, dyspepsia, nauseating, headache, and mood swing, which is similar to the premenstrual syndrome. So those kind of things you need to be aware of and need to tell your patient about, and tailor their treatment accordingly, and give them the choice to decide which is best for them, which is not. I hope by that I cover the points that's important about menopause and hormone replacement therapy. And if there is anything, you can write in the comment and suggest anything. Thank you.